So one of the techniques I mentioned was the drop technique. Drops are a special technique that utilizes something different on the table called a drop piece. The drop pieces are built into the table. They bring up the piece about a half an inch and lock it in place, and then with the right amount of pressure that piece drops down, allowing the adjustment to happen. The benefits of the drop piece is that I'm able to adjust with less force, about half as much force as I would have to use without the drop, and the patient feels less pain. Typically less force equates to less pain. So the adjustment happens more rapidly and with less pressure and less force, allowing the patient to feel more comfort when they're adjusted. I'll show you a couple of drops just by themselves on the table, and then we'll actually show you a drop with a patient. So you see the table here, different sections built into the table. I'm going to bring this drop piece up. Makes a little bit of noise, but you see how it locks in place about a half an inch higher than the other piece. And then with the right amount of pressure, it drops down. That dropping motion allows the adjustment to happen with, like I said, about half as much force as doing it without. The other benefit is for someone who needs low back or pelvic work on their skeleton, I don't have to do any twisting or rotation of the spine. I'm able to leave them in a neutral position, flat on their stomach, and still get that adjustment done without having to worry about twisting or rotating the spine.